Hello, dear friends. Today we will talk about small red spots on the skin, or rather, cherry-colored spots. You know, there are such droplet-like spots that appear on the chest, on the stomach, on the back, on the neck, sometimes on the scalp. Many people and even some doctors do not know what it is, and there is also a belief that these spots are a manifestation of diseases of internal organs. And even when I was a fourth-year student, our therapy teacher told us that these spots were evidence of pancreatic disease. Many doctors still think so, but in fact, these spots are common angiomas. An angioma is a benign neoplasm of capillaries. If we look at this formation under a microscope, we will see multiple vessels that are intertwined in a ball. That's it for you. Sometimes they're also called Campbell-De Morgan spots. In fact, these specks never turn into tumors and, of course, are not any signs of any underlying diseases of the internal organs, but these spots need to be differentiated from another condition, which is called spider angiomas. These arachnid angiomas differ from our specks in that in the center they have such a similar speck called a papule, and on the periphery there are multiple beaten small capillaries that resemble, in general, a spider with a body and legs. And if we figure out what it is, then in fact these spider angiomas are the result of acquired transformation of small vessels as a result of hormonal imbalance. Most often, hormones such as estradiol are involved here. With an increase in estradiol, for example, during pregnancy or when taking oral contraceptives, or, for example, in people who drink alcohol and have liver diseases, the liver cannot adequately neutralize estradiol, which is constantly formed in our body. Estradiol levels increase and, accordingly, cause vascular transformation. Spider angiomas can also occur in quite healthy people, for example, in children, and, in principle, they don't talk about anything so serious. Approaches to the treatment of these two identical conditions are different. If we are talking about spider angioma, then it is necessary, first of all, to find out whether there are any excess estradiol. If, after all, estradiols or other estrogens are elevated, it is necessary to try to bring them back to normal. Well, of course, if there is a pregnancy, then nothing can be done here. But, by the way, after pregnancy, such spider angiomas can pass by themselves. If they are caused by taking oral contraceptives, then you need to pick up some other drug. But if they are caused by liver damage, then it is necessary first of all to stop drinking alcohol and deal with other causes that may affect liver function. If the hormones are brought back to normal, but this does not help, then surgical methods come into play. They apply equally to ordinary angiomas and spider angiomas. That is, it can be either excision with a scalpel, which is rare, but most often it is the use of a laser or electrocoagulation, or a radio wave, or liquid nitrogen. In principle, all these methods work well and often do not even leave scars, since all these formations are superficial, and if the doctor skillfully removes them, then in fact after a while nothing remains in the place where these red dots were. That's it. As you can see, there is nothing wrong with these red spots on the skin. Thank you so much for watching. Goodbye. Be healthy.